We're going to start the rally. I hope people will pick up a sign, do some chants. It's going to be fun. My name is Maria Parra, and I'm part of Hoosiers for a Common Health Care Plan. We believe in universal health care, one payer system. H.R. 676 by Congressman Commonsense. We feel that this is the only way that we can get health care from the rich to the poor, that it can be efficiently distributed in this country. No more having people being sent to homeless shelters because they can't pay their health care. It's a humanity issue. It's not a Democrat issue. It's not a Republican issue. It's a human right issue. Okay, I also would like to welcome the Mobilization Force International Mass Campaign for Burma. They support universal health care. We also should be aware that the leader Aung San Suu Kyi, who is still held prisoner in her country, and she was elected president, and the others, the opposition, took her as a prisoner. She's a prisoner in her own home. So we are against that. We are for free public elections, and they should have honored her as being president and ruling that country.
Yes.
I just want to remind everyone, and I want to thank everybody here for having the courage to stand up and be for universal health care. We have so many people that won't come out because they're scared. We want to be their voice. Let this be today and forward. Let us be the voice that carries universal health care forward to our state capitol, to Congress. Let's rock.
Yes.
All right, let's start with our first speaker, Mae Johnson. She's the 1st District County Council representative who will get this going. Yay, Mae!
Thank you, Maria. Good afternoon, everyone. You know, when I look around, I have to wonder where the people are today, because this is an issue that impacts all of us. We should have so many people down here today that we can't move around the courthouse square here. Let me just say that Indiana is known as being the common sense state. And we are here today as Hoosiers for a common sense plan for health. Health care is a human right. I'm going to state a few statistics today as it relates to the health care situation in the state of Indiana. There are almost 900,000, I'm having a little problem with the mic here. There are almost 900 Hoosiers with no health insurance coverage at all. That's 14% of this state's population. And almost 160,000 children have no coverage here in the state of Indiana. Can you hear me? Okay. All right. The number of uninsured in the state of Indiana is growing twice the national average. We rank 23rd among the states in the number of uninsured people. We have the highest per capita rate of medically bankrupt families. That's over 77,000 Hoosiers, and it's growing by the day and by the week. Thank you. Healthcare costs in the state of Indiana are among the highest in the country. Our rising cost of health insurance coverage, combined with the lost productivity due to illness and job losses has made Indiana a less desirable place to do business. And this was quoted by Governor Mitch Daniels in newspapers across the state in June. Indianapolis is the second most expensive city in the nation for per family health insurance premium. And I'd like to remind everybody that the state of Indiana has a history of innovation in the medical arena, so you have to wonder what's going on. Eli Lilly and Indiana University Medical Center are known for creative ideas and innovative thinking. You have to wonder what is the thinking of some of our elected officials at the national level. I would like for everyone here today to make a commitment to talk to people in your families, your friends, your neighbors, your co-workers. We have got to get people to rally around this issue. It is the single most important issue impacting the economy of our country and our state of Indiana. You know, even if you have health insurance, you still aren't protected. Every one of us probably knows of a situation, either in our families or someone else, and we're all in this suit together, where someone who has worked all of their life, paid their insurance premiums, gets sick with a catastrophic illness, and the insurance company decides what kind of procedures they're going to get. In other words, insurance companies are deciding, in a way, who lives or dies.
That's right.
We're in a disastrous situation, and we need to get off the pot and move on.
Yeah.
What's disappointing, I don't know about the rest of you, I talk to people, and I'm getting a lukewarm response from people who should be down here today. I know it's Saturday and everybody's busy, but nobody's busier than those of us who are here. We're going to have to hold each other accountable, but you have to hold your elected officials accountable. You elected them. If they're not speaking out on this issue, then they are not representing you. Now, I can stand up here and quote statistics. You know, I can talk about this being an issue for the poor. The truth of the matter is that if we keep on going the way we're going, and we keep on letting people get away with corporate greed, yes, I said it.
Yeah, say it again.
We are going to have two classes in this country. That's the rich and the very poor. So let's get together, let's roll up our sleeves. If you haven't signed the petition, sign it. Take copies of it. When you go to meetings, challenge your neighbors to sign it, and let's make something happen on this issue. There's someone who is on the local level, and I'm going to take a little license today, Maria, but this lady has been responsible for organizing and pulling together a coalition of health organizations. So I would like to call Renetta Williams, the Executive Director of Health Visions, up to make some comments today. Come on, Renetta.
Thank you very much, May. This is an opportunity for us to express that everyone deserves health care. We do it on a daily basis. We here in Allen County have a prevention clinic, and it's for those people who are uninsured, and we see hundreds of people coming in who do not have health care insurance. It not only affects the poor, it affects you, and it affects I. So therefore, we need to make sure that our politicians know that we care. We all deserve to have health care.
Maria, I know that we have a list of speakers for the day, so I'm going to turn the program back over to you at this time. I'm going to stay around, and if you need me to come back up here and get the rally going again, I will be more than happy to.
Yeah.
Thank you, everyone.
Go, man.
Let's have a hand for Mae Johnson. We need more politicians like Mae, who understands what we go through, the little people, the middle class people. So when you look for the candidates, make sure they have your best interests, not the corporate interests.